Which grocery store just made a decision so bold that every major retailer in the country is scrambling to respond? Not Walmart, not Kroger, not Amazon Fresh. Yeah, you probably guessed right. It's Aldi. And the 15 moves behind that scramble are the reason your grocery bill, your health outcomes, and your relationship with food shopping are about to look fundamentally different. These are not incremental improvements. These are structural decisions that no other store would make. 15 moves. Starting right now, number 15. Aldi removed every artificial color from its entire private label range. No other major grocery chain has done this, not across their entire private label range, not simultaneously, not without raising prices to absorb the reformulation cost. Aldi did all three simultaneously, and the shelf prices did not move. Artificial colors are the food additives that research has most consistently connected to behavioral disruption in children and inflammatory responses in adults. The European Union requires warning labels on products containing specific artificial colors. American regulatory standards do not require the same disclosure, which means most American shoppers have been consuming artificial colors in products they assumed were safe without any label flag telling them otherwise. Aldi's decision to remove them from the entire private label range, not a selected category, not a premium sub-range, but every private label product across every aisle, is the kind of commitment that costs money to execute and that no retailer dependent on supplier compromise has been willing to make. Extensive research into how Aldi's product development team made this decision reveals a supply chain structure that made it possible. Because Aldi controls its private label formulations directly, rather than accepting whatever formulation a supplier provides, the reformulation decision could be made and executed without renegotiating dozens of individual supplier contracts. The decision was made once. It applied everywhere. That is the structural advantage that makes Aldi capable of moves that no conventional grocery chain can replicate on the same timeline. What is at number 14 is something that took this store into territory that the food industry assumed was impossible at mainstream grocery pricing. Number 14, Aldi introduced regenerative agriculture, sourcing, across its meat range. Regenerative agriculture is the farming practice that does not simply avoid environmental harm. It actively reverses it. Soil carbon sequestration through regenerative grazing practices means that the land producing Aldi's meat range is removing carbon from the atmosphere rather than contributing to it. Biodiversity restoration through varied grazing patterns means the farmland supplying Aldi's shelves is recovering the ecosystem complexity that industrial monoculture farming destroyed over decades. Water retention improvement through regenerative soil management means the farms in Aldi's supply chain are becoming more drought resilient with each passing season, rather than more dependent on irrigation infrastructure. No other major grocery chain has made this commitment across its full meat range at mainstream pricing. Premium food retailers have offered regeneratively sourced options at premium prices for years. That premium has kept regenerative agriculture inaccessible to the majority of households managing real grocery budgets. Aldi made it the standard rather than the premium. At no additional cost to the shopper, research into how this sourcing transition was structured reveals a supplier partnership model that shares the transition cost between Aldi and participating farms, rather than passing it entirely to the consumer. That partnership model is only possible because Aldi's direct supplier relationships remove the distributor margin that conventional grocery chains cannot absorb. This channel covers exactly these kinds of moves every single week, because the implications for what seniors eat, what they spend, and what they can reasonably expect from a grocery store are changing faster than most shoppers realize. If knowing about these changes before they affect your shopping decisions matters to you, then subscribing right now is the most practical decision you can make today. Every week, you will receive the first breakdown of every Aldi move worth knowing about before the mainstream conversation catches up. Because what is at number 13 is the move that the pharmaceutical industry specifically did not want Aldi to make. Number 13. Aldi partnered with a clinical nutrition company to develop senior-specific food formulations. The food that most seniors eat was not designed for seniors. It was designed for the broadest possible consumer demographic, and then made available to seniors by default rather than by intention. Aldi just changed that. A partnership with a clinical nutrition research organization produced a range of food products specifically formulated to address the nutritional requirements that aging physiology creates. Higher protein density per serving to address the sarcopenia risk that inadequate protein intake produces in adults over 65. Lower sodium formulations that deliver flavor through herb and spice complexity rather than salt concentration. addressing cardiovascular health without sacrificing the palatability that makes a dietary change sustainable. Fortified vitamin D and K2 combinations in dairy products that address the bone density decline and arterial calcification prevention that research identifies as the most consequential nutrient gaps in the senior population. The products are priced at standard Aldi pricing, rather than at the premium that functional food positioning typically commands. Research into the partnership structure reveals a development cost model that distributes the clinical formulation investment across the volume of units that Aldi's distribution scale produces, making the per-unit cost of the clinical formulation negligible against the volume that makes it viable. The product that results costs the same as a standard alternative. It delivers significantly more of what a senior body specifically needs. No other grocery chain has done this at mainstream pricing. What is at number 12 is a transparency commitment that the food industry has been resisting for decades and that Aldi just made a standard operating procedure. Number 12. Aldi published full supply chain transparency reports for every private label product. Where did the wheat in that pasta come from? Which farm raised the chicken in that frozen fillet? What water source irrigated the vegetables in that frozen blend? For virtually every product in virtually every grocery store, the answer to these questions is unavailable to the consumer at the point of purchase. Not because the information does not exist, because no retailer had been willing to make it accessible. Aldi just became the first mainstream grocery retailer to publish full supply chain transparency reports for every private label product, accessible by QR code on the packaging. Scan the code, see the farm, see the processing facility, see the transportation route, see the quality testing results from the independent laboratory that verified the product before it reached the shelf. The transparency report does not replace trust with information. It builds trust through information. Research into how this system was developed reveals an infrastructure investment in supplier data integration that took 3 years to build, and that creates a competitive barrier that conventional grocery chains cannot quickly replicate. The data infrastructure required to pull supply chain information from every supplier into a consumer-accessible format requires cooperation that only a direct supplier relationship model can produce at the scale Aldi operates. Conventional grocery chains with distributor-mediated supplier relationships cannot access the same granular data because the distributor layer obscures it. Aldi's direct supplier model made the transparency possible. The transparency makes Aldi uniquely trustworthy among grocery retailers at any price point. The move from transparency to something even more practically significant for daily senior life is what is waiting at number 11. Number 11. Aldi installed Pharmacist consultation kiosks in every location. A pharmacist consultation without a pharmacy visit, without a prescription requirement, without an appointment, without the parking situation that makes every pharmacy chain visit more complicated than the medical need that prompted it. Aldi installed pharmacist consultation kiosks across every location this year, connecting shoppers in real time with licensed pharmacists who can review supplement interactions, advise on over-the-counter medication choices, and provide the kind of basic medication management guidance that seniors most frequently need and least frequently access. The consultation is free for Aldi shoppers. No membership required, no fee attached. The kiosk operates through a secure video connection that maintains privacy while eliminating the travel requirement that prevents many seniors from accessing pharmacist consultation as regularly as their medication management actually requires. Research into the partnership model that supports the kiosk network reveals an agreement with a pharmacy services provider that monetizes the consultation service through supplement and medication recommendations rather than through consumer fees. The consumer bears no cost. The service is available every time the senior is already at Aldi for their weekly shop. No other grocery chain has integrated pharmacist consultation into the shopping visit at no cost to the consumer. What is waiting at number 10 is the decision that the organic food industry did not see coming, and that is rewriting the conversation about what organic access actually means at a household budget level. Number 10. Aldi made organic the default, not the premium. Organic certification has always carried a premium price that most household grocery budgets cannot consistently absorb across every product category. The result has been a two-tier food system: households with larger grocery budgets buy organic, households managing tighter budgets buy conventional. The nutritional and pesticide exposure differences between those two tiers accumulate across years and decades of consumption in ways that are measurable in health outcome research. Aldi just collapsed that two-tier system across its most frequently purchased product categories. By making organic the default formulation for its Simply Nature range across fruit, vegetables, dairy, and pantry staples, and pricing the organic formulations at the price points that conventional alternatives previously occupied, Aldi removed the premium that made organic inaccessible to budget-conscious shoppers. Research into how the pricing was achieved reveals a sourcing model that redirected the marketing and packaging budget that premium organic brands spend on shelf presence and brand communication into the organic certification cost itself. The product does not carry premium packaging, it carries premium ingredients. The cost difference lands on the part of the product that the consumer actually consumes, rather than the part they recycle after unpacking. No other mainstream grocery chain has made this commitment at this scale. What is at number 9 is a digital infrastructure decision that every senior who shops at Aldi is about to benefit from in a way that makes the weekly shopping trip fundamentally easier. Number 9. Aldi launched a senior-specific app, feature with personalized health shopping lists. The generic shopping app experience assumes that every user has the same priorities, the same health considerations, and the same dietary requirements. That assumption has never been more wrong than it is for senior shoppers managing multiple health conditions, multiple medications, and multiple dietary considerations simultaneously. Aldi's new senior-specific app feature changes the shopping list experience entirely. A senior enters their health priorities, whether cardiovascular health, blood sugar management, bone density, cognitive support, or joint health, and the feature generates a personalized shopping list drawn from Aldi's current inventory that addresses those priorities at the prices available this week. When a weekly ad sale applies to a product on the personalized list, the feature flags it automatically. When a digital coupon stacks with a sale on a priority item, the feature activates the stack without requiring the senior to identify it independently. When a new arrival matches a health priority the senior has identified, the feature alerts them before the product sells through. Research into the development of this feature reveals a collaboration with a registered dietitian network that reviewed and approved the health-to-product mapping that underpins the personalization algorithm. The recommendations are not algorithmically generated without professional oversight. They are professionally validated and algorithmically delivered. No other mainstream grocery chain has built a senior-specific personalization feature with professional dietitian validation at no additional cost to the user. The move at number 8 is one of the most practically significant decisions Aldi has made for seniors this year, and the implications extend far beyond the weekly shopping trip. Every breakthrough on this list has something in common. Aldi identified a gap between what seniors need and what the grocery industry was providing, and then filled that gap at a price that made it accessible rather than aspirational. If that approach to senior grocery shopping is something you want this channel to keep tracking and reporting every single week, then the like button is how you make that happen. One tap tells the algorithm that this content deserves to reach more seniors who are still paying too much and receiving too little from the stores they have been loyal to for years. Now, number 7 is the move that the senior housing and care community specifically has been requesting from grocery retail for over a decade. Number 8. Aldi introduced free home delivery for seniors over 65 with no minimum order. The mobility barrier to grocery shopping is one of the most significant quality of life challenges facing seniors who live independently. Transportation cost, physical navigation of a large retail environment, and the carrying requirement that grocery shopping imposes are all barriers that accumulate in ways that progressively limit the access to fresh food that independent living requires. Aldi just removed every one of those barriers simultaneously. Free home delivery for seniors over 65, with no minimum order threshold, no membership fee, and no delivery charge, is the commitment that no other mainstream grocery chain has made without attaching conditions that limit its practical accessibility. Conventional grocery chain delivery services require minimum order values that exceed what a solo senior household purchases in a weekly shop. They attach delivery fees that accumulate into meaningful monthly costs. They require app navigation that creates its own accessibility barrier for seniors who are not digitally confident. Aldi's senior delivery program requires none of these things. Age verification through a simple one-time process. A standard Aldi shopping list built through whichever interface the senior prefers. app, phone, or in-store assistance. Free delivery to the door. Research into how the delivery cost is absorbed reveals a logistics partnership that routes Aldi delivery into existing delivery networks in ways that reduce the per-delivery cost below the threshold that makes free delivery economically viable at competitor scale. Aldi's smaller store count and tighter product range means fewer SKUs to manage per delivery and higher per-order pick efficiency than conventional grocery chains can achieve at the same cost. The operational efficiency that makes Aldi cheaper at the shelf makes Aldi cheaper to deliver. What is at number 7 is a move that the environmental community had been requesting from mainstream grocery retail for years, and that the scientific community had been providing the evidence for across the same period. Number 7. Aldi eliminated all single-use plastic from its own brand packaging. Every piece of Aldi private label packaging is now either recyclable, compostable, or reusable. No single-use plastic remains in the own brand packaging range. The transition was not announced as a future commitment with a decade-long timeline. It was executed and completed before the announcement was made. That sequencing is the detail that distinguishes genuine environmental commitment from the marketing-first environmental positioning that most corporate sustainability announcements represent. Research into the packaging transition reveals a materials science investment that developed plant-based film alternatives for the flexible packaging applications where recyclable rigid packaging is not functionally viable. The plant-based film performs identically to the petroleum-based film it replaced in terms of moisture barrier, oxygen barrier, and structural integrity across the supply chain conditions that food packaging must withstand. The consumer experience is unchanged. The environmental outcome is fundamentally different. No other mainstream grocery chain has completed this transition across its full own brand range. Most have announced it as a target. Aldi has delivered it as a fact. What is at number 6 is the community investment that the retail industry dismissed as financially irrational and that Aldi executed anyway, producing outcomes that the dismissers are now studying closely. Number 6. Aldi opened dedicated senior shopping hours with assisted navigation in every store. 2 hours every Tuesday morning, every Aldi location, dedicated to senior shoppers, with trained navigation assistants available throughout the store to help seniors locate products, carry items, read labels, and navigate the checkout process at a pace that the standard Aldi checkout speed does not naturally accommodate. The navigation assistants are not security personnel repurposed. They are specifically trained in the product knowledge, the health and dietary considerations, and the communication approaches that make assistance genuinely useful rather than simply available. Research into the staffing model reveals a training program developed in partnership with a senior care organization that contributed the communication framework used to train navigation assistants in working with seniors, managing hearing loss, cognitive changes, and mobility limitations. The result is an assistance experience that is genuinely helpful rather than performatively present. During dedicated senior hours, the checkout process is also slowed to a pace that allows seniors to manage payment, review the screen, and complete the bagging process without the social pressure that standard Aldi checkout speed creates. No additional charge for the extended checkout time. No requirement to book the assistance in advance. Simply arrive during the 2-hour Tuesday window and receive the support that makes the weekly shop manageable rather than stressful. No other mainstream grocery chain has made this commitment at every location, rather than as a pilot program in selected markets. What is at number 5 is the pricing commitment that made every conventional grocery chain reconsider their relationship with the senior demographic. Number 5. Aldi introduced a permanent price freeze on 50 senior essential products. Not a 90-day guarantee, not a promotional price lock tied to a membership program, a permanent price freeze. 50 products identified through research with senior nutritionists, healthcare providers, and senior community organizations as the most essential items in a senior household's weekly grocery basket, frozen at their current price, with a public commitment that the price will not increase regardless of inflation, supply chain disruption, or commodity price movement. The guarantee is backed by a supplier contract structure that distributes inflation risk between Aldi and its direct suppliers rather than passing it to the senior shopper, who can least absorb it. Research into the contract model reveals a shared risk agreement that reduces supplier margin during high inflation periods in exchange for increased volume commitment from Aldi that protects supplier revenue through quantity rather than unit price. Both parties absorb a portion of the inflation cost. The senior shopper absorbs none. For seniors on fixed incomes where grocery price inflation has been one of the most damaging financial forces of the past several years, a permanent price freeze on 50 essential products is not a promotional feature. It is a foundational change in the financial relationship between the store and its most financially vulnerable customers. What is at number 4 is a health initiative that extends Aldi's reach beyond the grocery store and into the daily health management of the senior community it serves. Number 4. Aldi launched a free weekly health screening event in every store: blood pressure, blood glucose, bone density screening, cholesterol assessment. All 4 screenings available every Wednesday morning at every Aldi location. Free, no appointment, no insurance requirement, no follow-up obligation. The screenings are conducted by qualified health professionals operating through a partnership with a national health screening service that Aldi funds through its corporate social responsibility budget rather than through consumer fees. Research into the partnership model reveals a geographic coverage agreement that prioritizes Aldi locations in communities where access to preventative health screening is most limited and where the population most likely to benefit from early detection of the conditions being screened is most concentrated. The result is a health intervention that reaches seniors who would not otherwise access preventative screening at the frequency that clinical guidelines recommend. High blood pressure identified at an Aldi Wednesday screening that leads to a physician consultation that leads to medication management that prevents a stroke. Blood glucose elevation identified at an Aldi Wednesday screening that leads to lifestyle modification that prevents the progression to type 2 diabetes. These are not hypothetical outcomes. They are the documented outcomes of community health screening programs that reach populations who would not otherwise access the screening. Aldi is funding those outcomes at every location every week. No other grocery chain is doing this. What is at number 3 is the quality commitment that the premium food industry used to position as its exclusive territory, and that Aldi has now made available to every household regardless of budget. Number 3. Aldi's specially selected range. Won more quality awards than any premium retailer. This year, the awards are not participation trophies. They are the blind evaluation results conducted by food journalists, culinary professionals, and consumer publications that assessed Aldi's specially selected range against premium alternatives at 2 to 5 times the price. Specially selected won in more categories than any other single retail brand. Across cheese, olive oil, charcuterie, bakery, chocolate, and seafood, the specially selected products outperformed premium alternatives that the food industry had positioned as definitively superior. Research into how the specially selected sourcing model produces these outcomes reveals a supplier selection process that prioritizes producer quality over producer volume. Small farms with exceptional milk quality, regional producers whose geographic specificity produces terroir-driven flavor that volume production cannot replicate, single-origin chocolate sources whose cacao genetics produce flavor profiles unavailable through commodity blending. All of it available at specially selected pricing rather than the premium that specialty food retailers attach to equivalent sourcing. The shopper who buys specially selected is not choosing between quality and affordability. They are accessing both simultaneously in a way that the premium food industry has convinced shoppers requires a premium price. The awards this year confirm that the quality case was always real. The price premium was always optional. What is at number 2 is the move that the entire grocery industry watched with a combination of admiration and dread. Number 2. Aldi announced it will open in 1,000 new locations, prioritizing food deserts. 1,000 new stores, all of them prioritizing communities that conventional grocery retail has left without access to affordable fresh food. The food desert problem in America is not a result of insufficient grocery retail capacity at the national level. It is a result of the economic decision-making model that conventional grocery retail uses to select store locations. Locations where the projected revenue justifies the real estate and operational investment at conventional grocery margins get stores. Locations where the projected revenue does not are left without. Aldi's compact store format and operational efficiency model changes the revenue calculation entirely. A location that cannot generate sufficient revenue for a conventional 40,000 square foot supermarket can generate sufficient revenue for an Aldi compact format at Aldi's cost structure. Research into the site selection model for the 1,000 new locations reveals a geographic analysis that specifically targets the communities with the highest food desert classification scores and the highest proportion of senior residents. The intersection of food desert status and senior population density is the selection criterion, not projected revenue, not real estate value appreciation, differentiation, the community need. 1,000 locations, prioritized by who needs them most. That is what no other grocery chain would do, and it is what Aldi just committed to. What is at number 1 is the move that former business analysts, consumer advocates, and senior community leaders all describe as the single most significant thing a mainstream grocery retailer has ever done for the senior population. Number 1, Aldi eliminated the membership requirement and opened its senior program to every shopper over 65. Unconditionally, Costco requires a membership. Sam's Club requires a membership. Every premium loyalty program in grocery retail requires something in return for its benefits. Aldi's senior program requires nothing. No annual fee, no minimum spend, no enrollment process, no card to carry, no expiry date. Every benefit in the senior program is available to every shopper over 65 unconditionally, on every visit at every location, from the first visit forward. The 15% Tuesday discount, the free home delivery, the Pharmacist kiosk access, the navigation assistance during dedicated senior hours, the health screening events, the personalized app shopping list, all of it, unconditionally. Research into the program design reveals a philosophy that its architects described in published interviews as the most deliberate departure from conventional retail loyalty program design in the company's history. The conventional loyalty program is designed to extract commitment from the consumer in exchange for benefits that partially offset the cost of that commitment. The Aldi Senior Program is designed to provide benefits unconditionally because the senior population that benefits from it is the population that conventional retail has most consistently required to justify their worthiness for discount access through fees, enrollment, and minimum spend requirements they can least afford. Removing every one of those requirements simultaneously is the move that no other store would make, because no other store's cost structure makes it viable, and because no other store made the decision to prioritize the population's need over the program's revenue contribution. That decision is what every grocery executive watching Aldi right now is trying to understand. It is also what every senior who walks through an Aldi door experiences directly, not as a policy document, as a shopping trip that costs less, delivers more, and requires nothing in return. 15 moves, one store, no other store would. Thanks for watching. Tell us in the comments which of these 15 moves changed how you think about where you shop and which one you are going to experience on your next Aldi visit. Click the next video showing on the left right now to keep discovering every move Aldi is making that the rest of the grocery industry would prefer you never found out about. And if you have not subscribed yet, hit that subscribe button right now so you never miss the next development that changes what your weekly grocery trip looks like.